Need some water in there? Was that?
Thank you.
You're welcome. All right. I'm recording this and I will send this to you guys. Just in case you need it for note taking, whatever. So, just to reference back on or something. My name is Raymond Garcia. I am your instructor for the technician class. I've been instructor for, well, not instructor, technician for about 20 years. I started in 2000, actually 2000, end of 2000. I started at Eckerd's. Wasn't certified yet. I trained in-house for about almost a year. Took the test or the exam in November of 2001, passed it, and been tech ever since. Haven't really jumped off and tried anything else, especially around here in the oil and gas area. But I jumped from Eckerd's, which well, it's CVS now, to Walgreens. I started going to school there, tried to finish up some schooling there. Got my associates. Still didn't know what I wanted to do with it though. So I stayed in the pharmacy field for a good while. I ended up getting a job at the hospital here in 2003. And that was a very good experience there. I learned how to do IV mixtures under the hood. That's where where I did most of my work was doing IV mixtures, chemo mixtures, and stuff like that. Then I ended up going to Big Spring for a little bit. Stayed at this hospital from 2003 to 2012, and just needed something different. And the pay was better. Offered me a lead tech and everything else. So I stayed there, went to Big Spring because they offered me that lead tech, and stayed there from 2013 to end of 2019. And then I decided I wanted something different. Was about to start traveling, but I still had a son who was still going to school. I am out of La Mesa, and he's graduating this year, and I always told myself that once he graduates, I was going to start traveling. So that's still up in the works right now. The pay here is pretty good. As far as having to teach kids, and I teach the juniors and seniors to get ready for the exam. When they become seniors, they already have their a trainee license, and then at the end of this semester here, they should be getting ready to take their exam as well. You have 2 years to take it after the course. I wouldn't wait that long because you're gonna have to refresh it up. But I hope to give you the tools to help you pass that course. And one of the main tools that I will be pulling from is from this book here, Pharmacy Technician Exam Review by Mosby. They also have an application on the phone that you can pay for, about $30. And I can tell you, if you look over this on a regular basis, you should be able to pass the test. Easy. I'm here to help you understand certain things and what the exam is about. And hopefully we can have a good passing rate. I can tell you that I had a girl last semester, who took the exam already twice, and she had failed it twice, and she was on her final time to take it for the year. And she ended up passing it. So I could tell you this helped her out quite a bit. So it's called Mosby's Pharmacy Technician Exam. And this is what I'll be pulling from. I know this is supposed to be somewhat of a lab, but I'm here to let you know that if we're doing that hands-on lab stuff, it's not going to help you pass the test. I'm more geared to giving you questions as to what to expect on the test, and I can tell you, pulling questions from here, it pulls exactly from what the PTC exam gives. So that's my whole thing about that. Condensed curriculum has a different book that they used. I think it was this one. It's by Mike Johnston, and I know all you have is the online version of it. But to tell you, we won't focus a lot on the history or anything like that. I'm going to be more focused on the specific questions that it might ask you, so that you can prepare yourself for the test. This is the ptcb.org website, and you probably gotten one of these content outlines here in your paperwork. 40% of the test is going to be on medications, going over generic names, brand names, and classifications of medications. We'll be doing that today, going over certain questions on medications, what to look for, how to find or how to understand certain questions on drugs, and give you some hints onto what will help you out as far as guidance as far as different questions and different medications, and how to study these different medications. So we got generic names, brand names, and classifications of medications. Got therapeutic equivalences, and that's just mainly like your generic medications are equivalent to the brand name medications. They have the same ingredients. They work the same. You got your common and life-threatening drug interactions and contraindications. We'll touch base on that. Strengths, dosage forms, routes of administration, special handling and administration instructions, and duration of drug therapy. Common and severe medication side effects, adverse effects, and allergies. Indications of medications and dietary supplements. We'll touch on that. Drug stability, narrow therapeutic index for NTI medications, um, physical and chemical incompatibilities related to non-sterile compounding reconstitution. I could tell you you're not going to have much of hospital questions, I guess you could say. Like the math part, you won't have an extensive amount of math on there. So that'll be the last thing we'll finish on the fourth day. Um, it's more geared. The questions are more geared to retail pharmacy, which is like your Walgreens, um, community pharmacies, like anything that's out there other than the hospital. And also we'll go over proper storage of medications as well. But for the most part, we really want to understand medications, the generic, and how to like remember, give you hints on how to remember each of the medications. Um, and then we'll go on to federal requirements. On the next day we meet, we'll go on to federal requirements. That's 12.5% of it. Federal requirements for handling, disposal, and of non-hazardous and hazardous and pharmaceutical substances and wastes. Federal requirements for controlled substances prescriptions, and DEA controlled substances schedules. Federal requirements for controlled substances, the receiving, the storing, the ordering, the labeling, all that stuff. Your DEA forms, stuff like that. What the DEA number for a prescriber is and how to calculate that. Federal requirements for restricted drug programs and related medication processing. Pseudoephedrine, we can only get back behind the counter because of certain laws that require that now. FDA recall requirements. There's drug recall codes that we'll go over. And then 26.25% is over patient safety and quality assurance. We'll go over your high alert risk medications, your look-alike, sound-alike medications, error prevention and strategies, prescription or medication order to correct patient, tall man lettering, what that means, separating inventory, leading and trailing zeros, barcode usage, limit use of error-prone abbreviations, and stuff like that. Issues that require pharmacist intervention, like your drug utilization review, adverse drug events, OTC recommendations, therapeutic substitution, misuse, adherence, post-immunization, follow-up, allergies, stuff like that. Event reporting procedures, like your medication errors and adverse effects, types of prescription errors, and hygiene and cleaning standards, your hand washing, PPE, and that's a little bit towards hospital, which they only touch. I guess the exam only touches maybe a small part of that. It's not so much hospital like it used to be. Then finally, on the fourth day, we'll go over order entry and processing, procedures to compound non-sterile products, formulas and calculations, racial proportions, allegations, conversions, and stuff, which I know probably a lot of you got questions on that. Equipment supplies required for drug administration, what the lot numbers are for, expiration dates and national drug codes, and procedures for identifying and returning dispensable, non-dispensable, and expired medications and supplies. So that's what we'll be going over. And like I said, we can do some hands-on work, but I can tell you that it's not really going to help you in preparing for the test. And my main goal is to prepare you on the different questions that they ask and have you understand that part. Let's go back here once. Once you're ready to take the test, you have to set up an account here on PTCB, and you'll go into this site here, and you want to become a certified pharmacy tech, go back here. Okay, here we go. Which is, all right, this is where I want. When you get in here, you'll have different kinds of. What is it? What is it? Let me go back one. Trying to find the different tests that PTCB gives. Official PTCB practice settings. Gotta be there. First, you want to create an account when you're ready to take the exam. Not somewhere in here. Bear with me. Well, I guess this will sum it up. So you want to get in, whenever you take the exam, this is the one that you want to get into, CPHT. That's for the basic exam. This one right here is for compound sterile preparation. That's more geared to the hospital aspect of it. Then you also got your advanced certified pharmacy tech, which I guess it'll allow you for higher pay once you get past that test. That's also a test as well. Then you got your different certificates that you can gain. Billing reimbursement certificate. Maybe that'll help you in doing something online for pharmacies. Maybe remote work or something. You got controlled substances, diversion prevention and certificate. That one maybe will allow you to go to pharmacies and to pick up their waste, narcotic waste, their expired medications and stuff. Hazardous drug management certificate. That's more geared to chemotherapy work. Immunization. This is a new one. And I seen the other day, when I look here again here on Indeed.com, they were paying like, I think 30 or 40 bucks an hour for technician to get immunization. And that's mainly because of the COVID vaccine and stuff. And it seems like we're going to be doing that from here on out, giving immunizations from flu shots to vaccines to COVID, which probably is going to be given annually now. Medication history certificate. That can help again online in helping the elderly or patients with getting their medications and maybe counseling them. But you would have to receive that certificate. That does not defer. That does not let us counsel the patients or anything like that. It just helps us identify certain medications that may be equivalent with each other, that they work the same, that maybe the patient don't need, and we may need to contact the doctor or pharmacist to get certain medications off their list. And you also have your technician product verification certificate as well. So there's quite a bit of education surrounding pharmacy. You don't have to just be a retail pharmacy tech. You can get into, or you don't have to just be a hospital technician. You can work in compounding pharmacies where they just strictly do compounding, maybe just strictly do IV work. But there's a wide way, there's different paths you can take other than just being in retail or just a hospital setting. And that's why I was like, I want to travel. That's my thing. I want to see different places. So eventually that'll happen for me. Let's go to different jobs. Like this one in San Antonio, it's starting off at $35 an hour for a pharmacy tech. You know, um, they're looking here in big screen. Inventory specialist, that's another one of the certificates that you can acquire. And in Alabama, you're in 40 to 55,000 a year. That's pretty good for just being a technician, not having a degree or anything. 2240, that's pretty good, and that's even a remote work. So you can work from home on this one. Compounding. So there's a wide variety of paths that you can get into once you get done and pass the exam. But like I said, I'm not focused on doing labs that are hands-on. If I had like a software, which I'm eventually going to get, but I don't have right now, to help us put all that together for a lab, then yes, I will implement that. But for right now, I'm just going to be going over certain questions and what to expect on the exam. And here's another one, that Millen Memorial Hospital here. So I know they keep on trying to recruit me back, but I don't know if I want to go back there. So that's something to look forward to once you pass there. So, like I said, this is what I'm pulling from. They do have a app for it. And I'm just going to go over certain questions right now on what to expect. Then I'll go over over medications. This is pulled from the application. So you got your different sources, as what I went over here in PTCD. Got your medications, federal requirements, patient safety, quality assurance, order processing, and compounding. This one right here is more geared to hospital setting. So we'll start with medications and exam review. And you got a study mode and an exam mode. We'll do study mode for right now. And it gives you a selection of what exam you're going to take. This one right here is EXCPT. That one is not nationally certified. That's not a national certification. It's only a certification for certain states that accept that. PTCB is nationally certified. So if you're going to take a test, I would take that one. And then you got your CSPT, which is your compounding sterile preparation technician. And that's, again, mainly towards hospital. So we'll check on that and medications. And it gives you about almost 800 questions over that, 749. We'll pull 90 questions on that. And this, I'm just showing you to show you what to expect. If you want to write down or short form the question and answers, that's fine too. But I'm just going to be moving along. And if you do know the answer, go ahead and say it. So, are y'all able to read that? Everybody good? All right. Medications. A patient has been prescribed Singulair. Which of the following auxiliary labels should be affixed to the prescription bottle? Would you think it may cause drowsiness? Take on an empty stomach. Take 1 hour before or 2 hours after a meal. Or take with milk. I'm going to assume they cause drowsiness, which is incorrect. So Singulair should be taken on an empty stomach. So, I mean, okay. That's just something that we just got to remember when we go into the medication section here in just a second. Which of the following insulins have an onset of action of 15 minutes? Detmir, Glargine, Lispro, or neutral protamine Hagedron? Let's try Lispro. Lispro insulin has an onset action of 15 minutes. Detmir, Glargine, and neutral protamine Hagedron insulin have an onset action of 1 to 4 hours. How is insulin measured? Is it in glucose units, international units, in pH units, or USP units? What's that? Is it international, you said? Insulin is a biological substance and is used in terms of activity in international units. Good job. Which of the following is a contraindication? Directions by a pharmacist or a physician that the patient should stop taking a certain prescription medication. Computer alert indication that the patient is getting a prescription too soon. Situation in which the effect of one medication is changed by another medication that a patient is taking at the same time. Or a symptom or medical condition that indicates the inappropriateness of a form of treatment that would otherwise be advised. I'm going to assume C. No? Says a contraindication is a symptom or medical condition that indicates the inappropriateness of a form of a treatment that would be otherwise advisable. So that is letter D. Which is the generic name for Avandia? Anybody want to guess something? Nobody? I think it's rosiglitazone. Yeah. Generic name for Avandia is rosiglitazone, and it gives you the different, the other ones as well. Actos is the brand name for pioglitazone. Prandin is a brand name for repaglinide, and Januvia is brand name for sitagliptin. For the most part, I can tell you that when we're looking at medications, we want to understand the drug class. Well, first the the organ system that it's for, then the drug class, and then the generic name. And each drug, most drug classes will have certain endings that will give you a hint as to what medication it has. And I'll explain that here a little bit more in detail. Which of the following is not an effect of narcotics? Analgesia, CNS stimulation, euphoria, sedation. Which one of those is like most likely the different one out of all those? Which one? B as in what? Okay. The mask is it's hard to hear. CNS stimulation. That is correct. And that's one way to look at the question is, what seems the opposite of all the other ones? Because usually that's what the question will give. They'll give one specific one that's way different than the other ones. So narcotics have a tendency to sedate an individual, CNS depression, and CNS stimulation would have the opposite effect. So obviously, when you're dealing with narcotics, it's going to make you sleepy, usually puts you in a euphoric state. Analgesics, such as your Tylenol, stuff like that, Tylenol with codeine, stuff like that. So you kind of want to put all that together and find the one that seems the most opposite of that, especially when it asks what is not an effect of the narcotics. If a medication has awarded a B therapeutic equivalent code by the FDA, which of the following does it mean? It is therapeutically equivalent to other pharmaceutically equivalent products. In conventional dosage forms, it does not present bioequivalent problems. It is not the therapeutically equivalent to other pharmaceutical equivalent products. And it requires further FDA investigation and review to determine the therapeutic equivalence. I believe letter A, therapeutic equivalent, is the therapeutically equivalent to other pharmaceutical equivalent products, from my understanding. So to me, I know that wouldn't be the answer. So I'm kind of thinking, okay, it's probably one of the opposite ones or one of the less equivalent forms of the medication. So I'm thinking it's going to be, it is not therapeutically equivalent to other pharmaceutically equivalent products. And it states a B classification indicates the FDA does not consider it to be therapeutically equivalent to other pharmaceutically equivalent products. Drug products that the FDA considers to be therapeutically equivalent to other pharmaceutically equivalent products are classified with an A rating. Medications classified as AA products available in conventional dosage forms does not present bioequivalent problems. A B with asterisk classification requires further FDA investigation and review to determine therapeutic equivalence. What is the generic name to Avastin? A? Actually, it is bevacizumab. It's a generic name for Avastin. Bendamustine is generic for Bendeka. Bupivacaine is generic for Exparel, and bleomycin is generic for Bleonoxane. So, I mean, obviously you do have to study what the brand name is and what the generic name is as well. So, a patient is diagnosed with hypertension. Which of the following medications would be prescribed for this condition? So I'm gonna already assume, okay, hypertension deals with cardiovascular. Okay, so I'm already putting that in an organ system. Then I want to look at what drug classes are in the cardiovascular, and there's plenty, and we'll go over that here in just a moment. Uh, I can look at these levothyroxine, so that's telling me, okay, that's dealing with thyroid. So really, that's not going to be it. It could be lisinopril, uh, but I'll go back to that. Metformin, that to me deals with diabetes. So uh, that's another drug classes for anti-diabetic medications. And then you got simvastatin. And to me, it's either simvastatin or lisinopril. After you kind of break it down, and okay, so I know it's dealing with cardiovascular, and I know um, it certain cardiovascular meds will end in PRIL. Uh, let's see, drug class. I can't think of the drug class of it right now. When I go over it, we'll see it in just a second. I'm gonna just guess the lisinopril, but I know it's between this one and this one. So lisinopril is indicated for hypertension, and another thing is, hypertension would be another hint for that as well. Levothyroxine is indicated for hypothyroidism. Metformin is for diabetes mellitus type 2, and simvastatin is for hyperlipidemia. So, you kind of want to break it down, the questions and the answer as to what, as far as what you understand on organ systems, the drug class, the ending or the suffix or the prefix of the name sometimes gives you a hint towards that, and also the method of action or what the indication is for. And I kind of knew that this was for hypertension, but I didn't know for sure if this one was for hypertension as well. So we know that that's for hyperlipidemia. What is the name? What is the meaning of ADME? And this is mainly kind of want to weed out what is not ADME, like maybe automatic dispensing medication equipment. Kind of never really heard that on there. Automatic drug manufacturing exemption. That to me still doesn't sound the same either. So I'm going to go with either absorption, dissolution, metabolism, and elimination, or absorption, distribution, metabolism, and excretion. To me, maybe this one sounds the better answer. Nope, it would be the excretion. And you kind of want to, eliminate what you don't think is the correct one. Which of the following is the generic name for Percocet? I know some of y'all see this. Anybody want to guess? Believe it's the acetaminophen with hydrocodone. No, oxycodone and acetaminophen. So it's this one. Huh. Percocet is oxycodone with acetaminophen. Tylenol with codeine is acetaminophen with codeine. Vicodin, that's the one I was thinking of, is a hydrocodone with acetaminophen. And then you got Ultracet, which is acetaminophen and tramadol. Ultracet is a little bit Ultram. Ultram brand name is the generic name of tramadol. Tramadol is the generic name of Ultram. Uh, and this one also has ACET, Gives you a little hint on that, which gives you the, the beginning letters of acetaminophen. So that's another way to kind of break it down. Just kind of have to remember Vicodin, that it has hydrocodone, and the Percocet, it has the hydroxycodone. A patient is prescribed anastrozole for breast cancer. How is it administered? Is it administered intramuscularly, intravenously, orally, or subcutaneously? Of course, intramuscular is in the muscle, IVs through the vein, and subcutaneously is through the body fat. Orally is taken orally. I believe it is this one. Yeah. And I only know that because I've seen it on the shelf, and I know that it is a tablet. Which of the following is an example of fluoroquinolone antibiotic? Again, this is a drug class right here, so that would eliminate a lot of things if you understood what the drug class of, or certain drugs of fluoroquinolone under that drug class. Would it be cephalexin, ciprofloxacin, clarithromycin, or doxycycline? Fluoroquinolone. And I believe fluoroquinolone's in the floxacin, if I'm not mistaken. Yeah. So this is how I put it together. So this is my drug class, and I kind of remembered what the suffix or prefix of that drug class would end in. So we got ciprofloxacin, your Cipro, that's a brand name. Is an example of fluoroquinolone antibiotics. Then you got your cephalexin, brand name is Keflex. It's a cephalosporin antibiotic. That's another drug class right here. Clarithromycin, brand name Biaxin. Macrolide is the drug class, macrolide antibiotic. And you got your doxycycline, brand name Vibromycin. And your drug class is tetracycline antibiotic. So if you kind of start putting all that together when studying your drugs, it makes it easier for you to remember each one. Which of the following incompatibilities would be most aptly described as therapeutic incompatibility? So therapeutic incompatibility. The presence of light may cause deterioration of the ingredients. It occurs because of changes in solubility, which may result in changes in color or the formation of a precipitate. Change in the pH of a solution. The use of buffers and the type of solvent used may create problems. And also it occurs because of mixing together of two or more ingredients, resulting in change in the therapeutic response of the drugs. So the question is, following incompatibilities, what would be most aptly described as therapeutic incompatibility? But I guess that seemed like the most reasonable answer because of mixing together two or more ingredients. To me, that's what it's asking for therapeutically, the two ingredients, resulting in a change in the therapeutic response of the drugs. So a therapeutic incompatibility is mixing together two or more ingredients. That's just repeating it. So. If a patient has been diagnosed with depression, which of the following products could be prescribed? So, all right, we're dealing with depression, so that's going to be your central nervous system. So you want to go, after you find out what organ system it is, then you want to go what drug class it might be under. Again, we'll go over that as well. And once we find that drug class, we want to see if there's certain prefix or suffix that it may end in. Sumatriptan, that's mainly medications for migraines to me. Uh, and I only know that because I've been in pharmacy for too long. Salmeterol, I believe that's something for your lungs. So to me, it's either sertraline and stavudine. Sertraline, I can't remember if it's like Prozac or what, but to me that seems like the most logical answer. And I do kind of remember the ending of certain drugs for depression. So we're going to go with sertraline. Sertraline is actually Zoloft. Sertraline is the generic name for Zoloft, which is an SSRI, and that's the drug class SSRI, which I'll go over here in just a moment. Used in the treatment of depression. Salmeterol, which is Ceravent Discus, is indicated for asthma. Stavudine, Zerit, that's kind of a new one. I haven't really seen that one. Is used for treatment of HIV and AIDS. And you got your sumatriptan, which is Imitrex, which is used to abort migraine headaches. So if you break it down like that, and once you remember each medications, you should have no problem in passing that test. Drugs for injection are stored dry because the addition of water may absorb odors. The addition of water may contaminate the drug. The addition of water may decrease the shelf life of the drug. The addition of water may freeze and therefore inactivate the drug. So we already know that one. I mean, it can only freeze unless it's in a freezer or something 32 degrees Fahrenheit or below. So that's not going to even be it. The addition of water may absorb odors. No, that's really not it either. The addition of water may contaminate the drug. Not really. We do aseptic technique, it won't contaminate the drug. So to me, the only good answer is the addition of water may decrease the shelf life of the drug. So if you break it down like that, look for the correct answer. The one that really seems to make sense, shouldn't have a problem passing the test. Let's see, a physician has prescribed Norvasc for a patient diagnosed with hypertension. The physician has approved the use of the generic. Which of the following medications should the pharmacy technician select from the shelf? So, okay, we have something for hypertension, so it's something for cardiovascular. So we're looking at something that's for cardiovascular. Then after that, we'll look for what the drug class is and what ending or suffix, prefix or suffix it may end in. I know atenolol and carvedilol, by the endings of these, pertain to cardiovascular. Carisoprodol, I believe, is for, what was that one for? I believe like muscle spasms, maybe. And amlodipine. I can't remember what amlodipine. But to me, it's either between atenolol or carvedilol. I'm going to choose atenolol. That's incorrect. It's actually amlodipine. The generic for Norvasc is amlodipine. Atenolol is generic for tenormin. Carvedilol is generic for Coreg, and carisoprodol is generic for Soma. Become familiar with your top, I would say 200 drugs, brand name, generic, just to help you with these questions here. And I believe, didn't y'all get a list of like the top 200 drugs? A patient has been prescribed a fentanyl patch for severe chronic pain. How often should the patch be changed? What do y'all think? Which one? B. Every 2 days? Every 2 days? Uh, it's actually 3 days. Fentanyl patches change every 72 hours. That's just something that just got to kind of remember on that. What does the pharmacy abbreviation MDI mean? And we see that MDI is when we're taking albuterol inhalation. So I kind of gave you the answer on that one. That would be meter dose inhaler. Because it surely won't be measured density of intestines. I mean, where have you heard that? Measured dose insulin, not so much. And mild diabetes insipidus, not so much either. So kind of eliminate all the ones that really don't sound correct. Physician orders a quinolone antibiotic. Quinolone is another drug class. So that should already get your brain moving as to what to look for. The generic name of the medication would most likely end in what? So again, dealing with knowing the drug class, it gives you certain hints as to what the ending may be. And it's not all the time, it's just some of the times. So quinolones, would it be ciprofloxacin? Would it be something like penicillin? Would it be something like azithromycin? Or would it be something like tetracycline? Quinolone. Again, you would want to know the drug class, the ending of that drug class, and certain examples of generic names for that drug class. I'm going to guess tetracycline, ciprofloxacin. So ciprofloxacin, brand name Cipro, is a representative of the quinolone class of antibiotics. Cillin, mycin, and cycline represents penicillins. So this would be a drug class, and these would be the endings for that drug class. Quinolones, the ending for that drug class is floxacin, and macrolides and tetracyclines. We'll go over each of those drug classes and which one they end in. Penicillins is obviously Cillin. Mycin would be macrolide, and cyclines would be obviously tetracycline. What is generic name for vitamin B9? D? D? I think you're right. Yeah, vitamin B9D. Vitamin B12, cyanocobalamin, ergocalciferol. I think it's vitamin B2, and of course, sorbic acid is vitamin C. Which of the following dosage forms dissolves in the intestine instead of the stomach? Which one? B. Enteric-coated tablet. Good job. The enteric-coated tablet dissolves in the intestines instead of the stomach. And that's just because it has that extra coating where it it survives through the stomach and acids and goes into the intestines. You will also see like SR, which means sustained release, which also is dissolved in the intestines, and also delayed release tablets or capsules as well that dissolve in the intestines. For which of these conditions is Adacel indicated? Adacel. Is it for benign prostatic hypertrophy? Diphtheria, tetanus, pertussis. This is for hyperglycemia or hypertension. All right. For the most part, I know that Adacel is a vaccine. So which one of those would be a vaccine? B? Yeah. Adacel is tetanus, reduced to diphtheria, toxoids, and acellular pertussis vaccine, and is indicated, well, gives you all the answer there. A patient is prescribed amiodarone, atenolol, furosemide, and levothyroxine. Which of the medications may result in elevated BUN levels? I do not know what the acronym is for. Let me see what that acronym is for. Dealing with urea, blood urea nitrogen. Blood urea nitrogen levels. Which of the medications may result in elevated blood urea nitrogen levels? I know furosemide is a diuretic. Tenolol's dealing with cardiovascular. Hyperthyroidism is for levothyroxine. I'm going to assume amiodarone. No. Furosemide may cause blood urea nitrogen increase levels to be elevated. Huh. Okay. And I'm assuming because it takes out a lot of your potassium. That's the only thing I can think of. It's a loop diuretic, which takes out a lot of your potassium. And we'll go over that if we get to it here. So that's furosemide. Which medication is tapered off when being discontinued? Conjugated estrogens, that's like your Premarin. Would you be tapered off of that? What if it becomes discontinued or changed? I don't think so. Medroxyprogesterone, that to me that sounds more of a hormone, especially with progesterone to be tapered off. I don't think so. Simvastatin, usually steroids like prednisone, corticosteroids like prednisone, you need to be tapered off of. The only reason I know that is because what is it? Methylprednisolone is a corticosteroid along with prednisone that you do have to kind of taper off when discontinued. So a patient taking prednisone should be tapered off when it is being discontinued to avoid adverse effects. Usually dealing with corticosteroids, you got to get tapered off. And corticosteroids is the drug class for prednisone. Which of the following medications is a non-controlled substance indicated for diarrhea? Non-controlled substance. So is Acifex for diarrhea? I don't think so. These are all different brand names here. Got Imuran, Lotranex, and Librezee. I'm going to assume that one. Lotranex is a non-controlled substance indicated for diarrhea. Acifex is a proton pump inhibitor. Proton pump inhibitor is a drug class used treatment of GERD. Imuran is used to treating Crohn's disease, and Viberzi is a controlled substance used as an anti-diarrhea. So Viberzi, I've never heard of that one actually. That's new to me. That's the bad thing about me not being in a retail or a hospital, because I'm not up to date on certain medications. That's one of the drawbacks. If taken with alcohol, which of the following antibiotics may result in disulfiram-like reaction if taken with alcohol? I know there was a lot of interactions with the amoxicillin clavulanate, which is what is that name? I can see it. Augmented. I've never seen anybody get hurt over mixing cephalexin with alcohol. Not that it's recommended. Clarithromycin, metronidazole, I believe is an antiviral. I'm going to assume this one. Okay. Patient being treated with metronidazole should not consume alcohol while taking the medication because of the possibility of experiencing disulfiram-like reaction. What is disulfiram? Causes an adverse reaction to alcohol leading to nausea, vomiting, flushing, dizziness, throbbing, headache, chest, and abnormal discomfort. So don't mix your metronidazole with your alcohol. That kind of rhymes. Marina is administered intra-utrinely every what? Every week? B?
D.
C?
D.
D.
Yeah,
D? Really? Huh. Is that a? It's a what? Oh, okay. Marina. Okay. Well, I mean, at least I knew that one. Oh, okay. Well, there you go. You see. Patient has been prescribed potassium chloride as a potassium supplement. Which unit of measurement is associated with this medication? Is it international units, milliequivalents, milligrams, or milliliters? Huh? Boy, that is correct. Milliequivalents. International units is mainly insulin. Milligrams would be dealing with usually tablets and stuff like that. Milliliters, of course, is volume. Which term defines the process of how drugs are handled in the body? Is it pharmacodynamics, pharmacokinetics, pharmacology, pharmacotherapeutics? Which one? D? Actually, pharmacokinetics. My bad. Is the process of how drugs are handled in the body. Pharmacodynamics refers to the drug's effects on the body. Pharmacology is the study of drugs and their actions on living organisms. And pharmacotherapeutics is the study of therapeutic uses of and effects of the drugs. Pharmacokinetics. I guess kinetics deals with the process. Patient has been diagnosed with a deep vein thrombosis. Which of the following medications is an appropriate treatment for this condition? Deep vein thrombosis. You got enoxaparin, lovastatin, pramipexole, or pregabalin. Pregabalin, I believe, is dealing with your nervous system. Enoxaparin is a blood thinner. And can't think of what lovastatin is. If I just can't remember. I, if I remember what drug class statin was, it would give you a good hint. Pramipexole just doesn't sound right. I'm going to say enoxaparin. Yeah, enoxaparin is indicated for deep vein thrombosis. Lovastatin is indicated for hypercholesterolemia, so it's dealing with high cholesterol. Pramipexole is indicated for Parkinson's disease, so it's dealing with the central nervous system. And pregabalin is indicated for neuropathic pain. That's also musculoskeletal medication there. So enoxaparin, and I just put blood thinners and deep vein thrombosis together, and that's why I chose that one. Which of the following conditions is associated with the pancreas? Addison's disease, Cushing's disease, diabetes insipidus, or type 2 diabetes mellitus? C or D?
My uncle has diabetes. I don't know what he has. He can't see, but he has a lot.
And it deals with the pancreas?
He has a lot.
Yeah. So which one do y'all think? D? D? Okay. Y'all are good. Conditions associated with the pancreas include both type 1 and type 2 the diabetes mellitus and gestational diabetes. Addison's and Cushing's disease affect the adrenal gland. Okay. And diabetes insipidus affects the pituitary gland. Okay. Okay, I've already answered that one. Which one is it? Cyanocobalamin is which vitamin B? Vitamin B12. Cyanocobalamin, the other products are vitamin A, retinol, vitamin B1, thiamine, and vitamin B6, pyridoxine. All of the following medications are measured in international units, except, okay, we already know one, which is insulin. Heparin is measured in international units. So it's either between vitamin C and vitamin E. Which one of those is not? Believe vitamin C. International units are a form of measurement to indicate activity of a biologic product. Vitamin C is measured in milligrams. So it's just a process of elimination. What is the generic name for glucophage? Is that D? Say D?
Yeah.
Okay. Correct. Brand names and their generics are as follows. Glucophage is metformin. Amaryl is glimepiride. Glucotrol, glipizide, and micronase glyburide. Like I said, look over your top 200 drug list, and that should help you out.
That one is basically because metformin is a diabetic medication. You have glucose.
Yeah, that's it. That's true. By what route should a promethazine 25 milligram suppository be administered? To know this, you have to know what these abbreviations stand for. PO, does anybody know what PO stands for? By mouth. PR? What is it? Per rectal? That's per rectal. SL is sublingual. And I don't think that may be topical, but never really seen that one. So usually suppositories are given rectally, so per rectal. Suppositories are inserted into body orifices such as the rectum, urethra, and vagina. PR is abbreviation meaning per rectum. Which of the following is the best definition for a generic name? It's assigned by the drug manufacturer and is protected through the patent. Determined by chemical structure of the drug entity. Assigned to a medication and contains a word stem that has been issued by the U.S. Adopted Names Council. Determined by the botanical origin of the drug entity. Was that
B.
B? There's the proprietary name. What is that? Proprietary brand or drug trade name is chemical name is determined by chemical structure. And the non-proprietary application. That's interesting. I thought it was chemical structure, but it's actually assigned to the medication and contains a word stem that has been issued by the U.S. Adopted Names Council. So actually C. I would have picked that one too. Which of the following is the brand name for escitalopram? What's that?
Because I take select. I can't remember exactly what it is.
Can't remember what. Prozac is.
The depression of anxiety.
What's that?
Isn't it a depression of anxiety?
For Prozac? Yeah. This one right here? Believe so. Believe it's Lexapro. Escitalopram is generic name for Lexapro. Citalopram is generic name for Celexa. Fluoxetine is Prozac, and sertraline Zoloft. We saw this one already. Which insulin has an onset of action of less than 15 minutes? It would be Humulin N, that's an intermediate insulin. Lantus, Levemir, or Novolog. Levemir is long-acting, and I believe Lantus is long-acting. Humulin N is intermediate acting. I believe this is a short-acting, so I would say Novolog. And that's just I actually just did a review over that not too long ago, so that's why I kind of remember that. Novolog insulin has an onset action of 15 minutes. Levemir, Lantus, and Humulin N has an onset of action of 1 to 4 hours. Which disorder is also known as manic depression? Which one? See? Wow. Okay. Manic depression is also known as bipolar disorder. Good job. What term refers to the removal of drugs and metabolites by the kidneys through the urine? See? Yeah. Absorption is a transfer of drug into the blood from an administered drug product. Distribution is the movement of drug within the body once the drug has reached the blood. Excretion is the process of removing drugs and metabolites by the kidneys through the urine. And you got metabolism is the process of transforming the drugs. Good job. Which is another name for non-proprietary drug? Huh? You're right. Good job. Non-proprietary drug is another name for the generic drug. A proprietary or trade name is another name for a brand name drug. So proprietary would be with the brand name. Investigational drugs have not been approved for use by the FDA, and OTC medication is an over-the-counter medication that does not need a prescription from a physician to be purchased. An example of leukotriene receptors indicated for bronchospasm. So that's already, I'm already thinking, okay, we're dealing with the respiratory system, and allergic rhinitis in which of the following? An example of leukotriene receptors. Which one?
I'm doing all wrong. I agree. I think we need A.
A or B? It's actually Montelukast, I believe. Albuterol is, we'll go, if we can get there, because I know we're pressed for time. Let me see, I got it written down. This is what I'm about to go over here in just a second. So I got your drug classes here for your respiratory system. See, Montelukast here, and that is a leukotriene inhibitor. That's good. That's why I remember, because I remember typing that up. And also, your albuterol is a bronchodilator. What else? Fluticasone. Let's see, right here, glucocorticoid, fluticasone. And again, Montelukast is your leukotriene inhibitor. So again, you want to become familiar with your drug class here and what drug fall into that. And like I said, there's certain endings that they have that might give you a hint towards that. Which is the route of administration for Victoza? Victoza. I know I've seen that commercial on TV, but I can't think of the name for it, what it's for. Victoza. Anybody want to take a guess? Subcutaneous? Lucky guess. So, can't remember what Victoza is. Let me remember that. An injection and a diabetic to treat type 2 diabetes. Okay. All right. All of the following medications are macrolides, except which one? Do we remember what ending was for macrolide? C? Because all these have the same amount of endings. That is a process of elimination. And yes, you are correct. Doxycycline is a member of tetracycline family, drug class tetracycline antibiotic. Which of the following is an example of a beta blocker? Beta blocker is a drug class, and it has ending. Let's go back up here. Beta blocker is concerning the cardiovascular, and I got beta blocker here, ending in OLOL for the most part. You do have exceptions. They aren't all going to end in that, but for the most part, that gives you kind of a heads up on it, though. So, which one ends in OLOL? Metoprolol. So again, process of elimination. Understand the drug class, certain endings, and you can come up with the correct answer there. So we got metoprolol or toprol XL is a beta blocker. Candesartan, Altecan is an angiotensin 2 receptor antagonist. Enalapril, Vasotec, is an ACE inhibitor. Remember that ACE inhibitor, enalapril, ends in PRIL. Spironolactone, aldactone, is a potassium-sparing diuretic. Potassium-sparing diuretic is your drug class. Generic name spironolactone. And candesartan, I believe that's an ARB and ARB. And those usually end with SARTAN. So once you become familiar with that and how to break it down, you should be able to find your answers. Which of the following medications is classified as selective estrogen receptor modulator and indicated for breast cancer? So, what's that? There's an app. It's called Mosby's Pharmacy Technician Exam Review. There's an app. Can you find that? Did you find what do you have? Google?
On Kindle, I found it on Google. That's what I couldn't find the book. Even on the app store, it would only be
Huh. But what do you have? Like on your phone, what do you have?
Android and Apple.
Android?
I searched the book.
Huh?
I searched on both.
On your phone though? Not on that, but on your phone.
Yeah.
And you couldn't find it?
No, it would show me a link to the Apple.
Try put Mosby Pharmacy Technician application. You can find it in Google Play if you got Android.
Is this a book or this is like has the questions?
There is a book to it, and there's an application for it as well. Same thing, same exactly. Yeah, and well, this was like $40, 38. I think I paid like 38, and I don't know if it's one time or annually. I think it's annual payment. What's that? You still not? How about you bring it over here?
So it's this. So this shows up, but when I click on it, it doesn't load. And when I search it directly, it shows other Mosby
You have like
applications, but it doesn't show.
You have the Play Store?
Yeah, I've done that too. It'll take me to other Mosby. And then your citizen application. Yeah. You show other information. Yeah, that's why I bought the book on Amazon instead, just to have the
So you have the book?
The book, yes.
Okay. Well, you should be able to pull that up and it'll give you a code here.
Okay.
Then just go over that right here and put in that code and you'll be able to get
No,
it.
wait, let me check the book.
Yeah, if you do get the book, I'm surprised you can get, but you get that.
No, I'm just gonna order one right
Okay. Huh.
I can get an ebook, but I would rather. Yeah. Yeah, I thought ended up on give me
Let's see. Would try Mosby PTCE. Maybe that. You know, they don't have it on here.
You can find it on the computer though, right?
Yeah. If you get the book, you'll go into evolve.elsevier.com, which it says right here. And then you'll enter your code and it'll let you in.
To do like this, like you're doing?
Mhm. Yeah. I'm surprised.
Yeah, the picture says after 25 days.
That is interesting. I'm sure I'm not doing anything wrong. Wow. I guess they want y'all to buy the book. That is crazy. I mean, that's the first time I've seen that. Because I do got the app. I paid for it. I guess I'm not going to get to renew it then. Okay. That's. Well, at least y'all can get the book. And it's the same questions. Everything's the same. Um, there's no difference. So let's go back to. Which of the following medications is classified as a selective estrogen receptor modulator? That is your drug class and indicated for breast cancer. Process of elimination, I believe tamoxifen was for cancer. It's a cancer for cancer drug. Yeah. Tamoxifen is a selective estrogen receptor modulator indicated for breast cancer. Anastrozole is an aromatase inhibitor. Fulvestrant is an estrogen receptor downregulator. And Magestrol is a progestin. All are indicated for breast cancer. Wow. Okay. So it's for the most part we have to understand or know the drug class for that certain medication. Which of the following medications would be appropriate to dispense to a 64-year-old woman diagnosed with osteoporosis? Estradiol is a hormone. Naproxen is mainly that's a leaf. That's for pain. Sertraline again, that is that's like Zoloft. That is for dealing with your mental state. So I know this because I know the brand name of it, alendronate with vitamin D, which is Fosamax with vitamin D. And Fosamax is for osteoporosis. So alendronate with vitamin D may be dispensed to a 64-year-old patient according to the American. And that's only because I know that this is for osteoporosis. What is the meaning of the abbreviation K when found in patients' lab results? Is it calcium, potassium, phosphate, or sodium? Which one? B? You're correct. K is potassium, Ca is calcium, PO4 is phosphate, and Na is sodium. So if you know your chemicals there, chemical chart, I guess, from chemistry. Which of the following is the generic name for Pepsid? I know ranitidine is Zantac. Cimetidine, nizatidine. Can't remember what those are for, but from experience. I know famotidine is Pepsi. The generic name for Pepsi is famotidine. Cimetidine is the generic name for Tagamet. Nizatidine is the generic name for Axid, and ranitidine is the generic name for Zantac. These are all for stomach ailments like your GERD or your what is it? I wouldn't say H. pylori, but I just know it's for stomach ailments. And what gives it away is these endings right here. There's ARBs. That's a drug class, and we'll go back up to cardiovascular and angiotensin 2 receptor blockers, ARBs. They end in sartan. So you got your losartan, candesartan, valsartan, telmisartan, or irbesartan. It's for hypertension, congestive heart failure, and prevents kidney failure. So let's go back to the question. ARBs are indicated in treating disorders associated for which body system? So ARBs are for high blood pressure. Well, let me see. Hypertension, congestive heart failure. So we would say cardiovascular. And that's when, you have to put your organ system and your drug class together along with your generic name. And let me show you how I have it here. You got your organ system, then your drug class, then the word stem. Not all of them will have a word stem for you to go by. There are some exceptions. Like this one ends in AZOLAM, but it also has diazepam and lorazepam. So they don't all end in AZOLAM. It just gives you a hint. And know which generic names fall into that drug class, as well as the indications for it. All right. A diabetic patient may take which of the following dosage forms? Elixir, emulsion, spirits, or syrups. So a diabetic patient can't take sugar. There's sugar in syrups. Emulsion, I believe. Would it be spirits or elixir? Let's guess elixir. No. Elixir, spirits, and syrups contain alcohol or sugar. Patients with diabetes should not receive any of them. Emulsions do not contain alcohol or sugar. Okay. So these three got sugar or alcohol, and emulsions doesn't have any of it. So, what is the brand name for rabiprazole? Rabiprazole. Protonix is pantoprazole. Let's see. No, I didn't get to digestive. Nexium. Let's think what Nexium is. What's that? I can't hear you.
I'm sorry. I think it's I've seen it on ads on TV for depression. So I don't think it's that. Yeah. Oh, after that's how much attention I paid. I just remember seeing it.
I don't think it's Nexium. It's got to be Dexlin or
I
Asphyx.
remember what you're talking about. I think it's for irritable bowel syndrome or Crohn's. I think that, yeah, because it's like a purple logo. That's yeah. No, that's a group for irritable bowel syndrome. It's
I'm gonna assume it's Asphyx. Asphyx is the brand name for rabeprazole. Dexalent is the brand name for dexlansoprazole. I kind of knew that generic name because it had that Dex in it. Nexium is a brand name for S-omeprazole, and Protonix is the brand name for pantoprazole. And again, they all are ending with Prazole, which automatically tells me it's dealing with the stomach, acid reflux, GERD, etc. Which of the following is not an antihistamine? Budesonide, cetirizine, diphenhydramine, or loratadine? A. Good job. It's a corticosteroid.
yeah, they gave my kids all
I don't know if that was the one that they said that was the miracle drug for COVID.
No, that was hydro.
Well, no, there was a inhalation that they were talking about that the doctor was giving, which decreased it, but it didn't really eliminate it. Which is the generic name for Seroquel XR? Ergocalciferol, meloxicam, quetiapine, venlafaxine. What? I know. That's something that you would have to look over your top 200 drugs. Meloxicam, I don't think is it. I think it's venlafaxine. Quetiapine. Quetiapine is generic for Seroquel. I guess this QUE should have gave it away here. Ergocalciferol is generic name for a vitamin D2. Meloxicam is generic name for Mobic. And venlafaxine is generic name for Effexor XR. Okay. Rhinitis medicamentosa is an adverse reaction associated with which drug classification? C? Decongestant? Good job. Is it an adverse reaction? Okay, good job. How did you know that?
Rhinitis is no, the decongestants feel no. And like my aunt has had worries about reducing the bathroom.
How you putting all that together? That's the way you're supposed to do it. Good job. What is the generic name for Neurontin, which is indicated for epilepsy? Gabapentin, levetiracetam, phenytoin, topiramate. Phenytoin is Dilantin. I know the answer. I want to know if y'all eliminate certain. A? You're right. It's A. Gabapentin is generic name for Neurontin. Levetiracetam is a generic name for Keppra. Phenytoin generic name for Dilantin, and topiramate generic name for Topamax. All are indicated treatments for epilepsy. And the Neurontin is also good for nerve pain as well. And that's what it originally was for, is for, well, actually it was originally for epilepsy, but they found out that it was good for nerve pain as well. And they just recently made it a controlled medication because of the how good it works for pain. Which of the following medication is available over the counter as a smoking cessation agent? Chantix, Nicoderm CQ, Nicotrol NS, or Zyban? Anybody a smoker here? It wouldn't be Chantix. I've seen that as a prescription. Zyban, I don't think so. To me, I'm dealing with Nicotrol or Nicoderm. What's that? Which one?
B.
B. Good job. Nicoderm CQ is available as an OTC smoking cessation medication. Chantix, Nicotrol NS, and Zyban are prescription smoking cessation medications. I hear Chantix gives you like lucid dreams or something like that. I don't know. And a lot of these prescription drugs also, some of them have you like night walking, sleepwalking. I'm saying. St. John's wort will decrease the effects of which medication? Duloxetine, paroxetine, warfarin, or venlafaxine? Which one looks like the most opposite of the C? St. John's wort will decrease the effects of warfarin. It will increase the effects of duloxetine, paroxetine, and venlafaxine. And I believe those are dealing with your central nervous system. Amlodipine is indicated for which condition? Angina, arrhythmia, hyperlipidemia, or hypertension. Let's go back to cardiovascular here. So we know that amlodipine is a calcium channel blocker, insulin dipine, and it is for hypertension, angina, and arrhythmias. So we'll go back. So we got angina, arrhythmia, hyperlipidemia, hypertension. Huh. I'm going to go with the first one, hypertension, because that was listed first anyways. And I mean, it's good for all these other ones, but for the most part, it's the best for hypertension. Which of the following medications could be used as a prophylactic for migraines? Imitrex, Inderal, Zomig, or butorphanol? I believe it's Imitrex. Nope. Inderal. Inderal can be used prophylactically for migraines. Imitrex, Zomig, and butorphanol are used as an abortive therapies for migraine headaches. Okay. So Inderal is the one. Which insulin has the longest duration of action? Anything if you see NPH insulin, it usually is intermediate, which is kind of in the middle. Regular insulin is a short acting, so that's kind of it works within the first 15 minutes. B or D? B? D. Good job. Ultralint insulin has a duration of 18 to 20 hours. Regular insulin lasts 5 to 6 hours. NPH lasts 10 to 16 hours. And Linta insulin has a duration of 12 to 18 hours. Good job. All of the following are brand names associated with albuterol, except which one? I could already see it. Which one do y'all think? ProAir? It's actually Flovent. Flovent HFA is the brand name for fluticasone. ProAir, Proventil, and Ventolin are brand names for albuterol. You'll find out that certain medications, they'll only have one generic name, but quite a few brand names, like maybe ibuprofen, got your Advil, and then your Motrin, stuff like that. So that should be in your top 100, 200 drugs. So, which of the following medications is indicated to reverse a heparin overdose? Promethazine hydrochloride injection. Promethazine is it's an antiemetic for vomiting, nausea. Propranolol, protamine, or the Retaplace recombinant injection. Heparin overdose. Heparin is a blood thinner. So what would make your blood thicker? D? D as in dog? C. Protamine sulfate injection, so it's C, is indicated to reverse heparin overdose. Which medication is indicated for a patient undergoing an acute myocardial infarction? Methylprednisolone is a corticosteroid. Methotrexate is a chemo drug. This one I know, again, you got your OLL, which deals with cardiovascular medications. And I can't figure what milrinone stands for, so I would go with C because it dealt with cardiovascular, and myocardial infarction is dealing with cardiovascular. Let's go back to this one right here. What was the name of the med? Metoprolol. So we do got metoprolol here. It's a beta blocker. It's for hypertension, angina, and myocardial infarction. So just process of elimination. Again, know what organ system it's under. Know the drug class, certain drugs within that class, certain endings. Like with this one, it ended with OLOL, had metoprolol, and it's for, and know the indications, which is myocardial infarction. 75-year-old male is being treated for angina with nitroglycerin. Which of the following medications is contraindicated for him? So we know that nitroglycerin kind of increases your heart rate. So what else works as increasing your heart rate? There's naproxen. Naproxen is for pain. Only other medication that I know that increases heart rate that's for pain is Tylenol. Zolpidem, I know we've seen that one before. I can't think of what it is. Amoxicillin clavulanate, that's an antibiotic. Does anybody know what sildenafil is? That's your Viagra. So for the most part, I remember working in the pharmacy back when I just started. We had a guy who would come in always for his sildenafil, and he also had nitroglycerin. I don't know if it was a time before they knew that these two interacted with each other, and increased it dramatically. But he passed away, believe taking sildenafil along with nitroglycerin because it upped the blood pressure. So sildenafil, and sildenafil is you'll find that they'll use a lot of that for heart patients as well. It's not only for that one thing, but they do use that for heart patients as well. Is it contraindicated in patients taking nitrates because of the potential decrease in, oh, well, it decreases the blood pressure, not decreases severely. Patient is diagnosed rheumatoid arthritis. Which medication is an appropriate treatment? I kind of just know this because I know the commercial. Solucortef is a corticosteroid, I believe. Apidra and cytovine, I've never really heard of. I think it's Remicade. Yeah. Remicade is indicated for rheumatoid arthritis. Apidra is used in treating diabetes mellitus. Cytovine is used for CMV prophylaxis. And solucortef is used for corticosteroid responsive conditions. Which of the following analgesics may cause liver damage as an adverse reaction? I think they took it off the market because of this, and they brought it back. C. Celecoxib is Celebrex. That's for arthritis. Naproxen is your leaf, and aspirin is aspirin, the blood thinner. It's actually, I believe, acetaminophen. Yeah. They took it off at one point. I don't know if I remember.
I knew it did that, but I didn't know it took off.
Yeah, and they had to reformulate it because it was causing liver damage. But it was a while back. It was like early, like maybe early 2000, 2005. Well, I wasn't. I was 20 something years old. But yeah, they did take that off. Oh yeah, yeah. They have a whole. They had to package everything and put on what it could cause and stuff like that. It was this craziness. But I mean, any of these will affect the liver. Ibuprofen affects the liver if you take too much of it. Which of the following over-the-counter medications is a stool softener? I got to know this one. What is it? Citracel is a fiber laxative. Imodium AD was that anti-diarrheal? Anti-diarrheal? Gas X is for gas. So it's B. Yeah. Stool softener is Colace.
I don't know that. I don't know why you would do it.
Well, that's what, I don't know if y'all have kids. Usually that's what they give after you're pregnant. If you cannot defecate.
But you can find that.
Well, that's what I kind of thought, But yeah, it is Colace, docusate sodium. It's a stool softener again. Citracel is a laxative, fiber laxative. Gas hexamethicone is for gas, anti-flatulent. And Imodium AD, loperamide is for diarrhea. These are all OTC meds. That's why I kind of, because they're all over the counter medications. Kind of like if you like strolling down through the aisles or something, might have seen it. That's the only reason I kind of figured y'all would have known. Which of the following electrolytes is necessary for the heart to function properly? Which one? B?
I think C.
I believe it's C. Potassium is necessary for the heart to function properly. Calcium is needed to maintain both bones and teeth. Iodine is required for the thyroid to function. And zinc aids in building up the immune system, which we know that because COVID, y'all have taken that to increase your immune system. Also with calcium, vitamin C increases your immune system as well. Which of the following medications may exacerbate heart failure in an elderly patient according to the Beers criteria? Exacerbate. Make problems, makes worse. What would make worse for heart failure for a patient? Naproxen is a leave. Medroxyprogesterone, the progesterone tells me that it is a, what is it? A hormone. Bupropion, I believe it's a smoking cessation medication. And ondansetron is for nausea. Thing D? B? To me, I think females would be taking this because of progesterone, but I'll pick it. Actually, naproxen, which is an NSAID and had been shown to exacerbate heart failure in elderly patients. Okay.
What is it? What is that?
Excuse me?
What is the leaf?
It's a leaf. The things you'll find out and learn. Which of the following is true about pharmaceutical equivalent drugs? I take a leave all the time. I mean, especially after doing umpiring games, like 7 games or something. But I guess I'm not as old as what they stated in the question. Which of the following is true about pharmaceutical equivalent drugs? So we're looking at pharmaceutical drugs that are equal in strength, equal in therapeutic, in how they work. So chemically different, but are expected to produce the same therapeutic outcome and toxicity. Chemically identical in strength, concentration, dosage form, and route of administration. Sounds to me like the most what I'll try to say, logical one. Contains different active ingredients. So it's asking true about pharmaceutical equivalent drugs. Price exactly the same as the brand names. Therapeutically equivalent. So that would be B. Pharmaceutical equivalent drug is one that is chemically identical in strength, concentration, dosage form, and route of administration. Pharmaceutical equivalent may differ in shape, scoring configuration, release mechanisms, packaging, coloring, flavoring, preservatives, and expiration time. But for the most part, it's all identical in strength, concentration, dosage form, and route. What is the generic name for Lopressor? You can't, they all end in the same. This would just, you know this because you would have to look over your brand generic drugs, your top 200 drugs, and it is metoprolol. That is the generic name for Lopressor. The patient's pulse rate is below 60 beats per minute. The patient is deemed to be bradycardic, which is a slow pulse rate, slow heart rate. One would expect that the condition is one when the heart is beating faster than the normal range, beating at normal pace, beating slower than the normal range, not beating at all. See? The root card indicates that the heart is involved in the word, and Brady indicates slower than. Tachycardia is condition when a heart beats faster than the normal range, greater than 100 beats per minute. Which of the following is the generic name for Paxil? And again, you just have to look over your top 200 drugs. Which one? Boy, you are correct. Good job. Paroxetine is generic name for Paxil. Lansoprazole is generic name for Prevacid. Prevastat is generic name for Pravachol. And sertraline, again, we see that again, generic name for Zoloft. Which insulin requires a prescription? I don't know if y'all have bought any insulin before. Which one seems like the normal ones and which one seems like the odd one? D is in dog? Correct? Oh, well, no. Humalog. Wow. I've never seen novel in L, honestly. I've seen all these other ones, and I don't remember that one being needing a prescription. So obviously it's Humalog. Let me make sure on that one. Well, it says Novolog, so Humalog is Novolog or Aspart. So, yeah. You and me. Which of these proton pump inhibitors, that is your drug class, is available as a prescription medication and as an OTC product? Again, you got your dexlansoprazole, which is your Dexilant. Lansoprazole, I can't remember what that one is. Pantoprazole is your Protonix, I believe. And rabeprazole. Which one of these have you seen over the counter? I believe you can get Protonix over the counter now. And as well, there is prescription. Well, no. That's appraisal. Privacy. So I guess pantoprazole is just over the counter now and not in prescription. Huh? Still prescription? Really? Well, I know Prevacid is over the counter, and there's one Prevacid that comes in a box. If you got H. pylori, that's what they give you. That's the prescription of Prevacid. And then you got your OTC Prevacid for your GERD or whatever you have going on. That's new to me. Digoxin is an example of a what? Beta blocker, calcium channel blocker, cardiac glycoside, or a sodium channel blocker. What's that? Let's look at, let me see. I believe it's under diuretics. Maybe not. I don't have that one here. Digoxin and lanoxin work the same. It's not a beta blocker because it doesn't end in OLOL. What's a calcium channel blocker? Let's look at that one. And I'll send this to you guys just for reference if you want to reference back. Calcium channel blocker ends in DIPINE, and it's for hypertension, angina, and arrhythmias. That's not it. Which one? D. Let me look. Did I have that one on there? Sodium? No. You could be right there. No. Cardiac glycoside. Did I have that on? Cardiac glycosides. No. I think I didn't put it on there because it was the only medication that was on there. And I just put on what I thought was the most used. So it is a cardiac glycoside, and it is in the book here as well. I do remember reading it. How is the insulin measured? What is it? Units. Good job. That's something to remember. What is the brand name for sertraline? You've seen that already like 5 times. Zoloft. Sertraline generic for Zoloft. Generic names for other branded medication are as follows. Again, Celexa, citalopram, Paxil paroxetine, and Prozac fluoxetine. Which USP term refers to a temperature that is 20 degrees to 25 degrees Celsius? Is that controlled room temperature? Is that excessive heat? Is that room temperature, or is that warm? Which one? Cat? Controlled room temperature is defined as 20 degrees to 25 degrees Celsius. I know it's easier to they would do it in Fahrenheit. Excessive heat is any temperature above 40 degrees. And room temperature is defined as the temperature prevailing in a working area. A warm area is 30 to 40 degrees Celsius. How often should a patient change her prescription for Climera or estradiol transdermal? I would not know this one. What is it? D? Oh. Good job. Should be changed weekly. What's that? It's estradiol. It's a hormone.
I remember that is.
Well, you're doing good there. Stomach irritation is an example of an adverse effect associated with which of the following, except which one? Um, NSAIDs are the non-steroidal, I forgot what the A means, anti-inflammatory drugs. And that's your ibuprofen, your Aleve. Should be either aspirin or acetaminophen. I've never seen aspirin or heard of aspirin giving you stomach irritation. They, A? Which one? Boy? Common side effect of aspirin, corticosteroids, and NSAIDs is stomach irritation. Wow. So acetaminophen does not produce this side effect. So not only did they fix it with the liver, they fixed it with the stomach as well, I guess. How is cytarabine administered? Cytarabine, to me, that sounds like chemo. I'm going to guess IV. What do y'all think? Yeah. Nope. Intrathecally. Okay. That's not too fun. Between the layers of tissue which cover the spinal cord. Okay. When two drugs are combined and said to be synergistic, these drugs together would be what? Effective, less effective, more effective, just as effective, synergistic. Relating to the interaction or cooperation of two or more organizations, substances, or other agents to produce combined effects greater than the sum of their separate effects. So that would be one. When something is synergistic, there is more effectiveness from the combination of the products. Which of the following is an example of drug duplication? And this is like what I was saying before. When we are entering orders for a patient, techs have to be observant as to making sure that they ain't taking two drugs that work the same. And then we would have to tell the pharmacist that these two drugs work the same. They are doubling up on it, so which one would be good to discontinue? And that's when the pharmacist would call the doctor or counsel the patient as to which medication works better for them. So you kind of have to know what two medications work the same. Coumadin and Zetia. Coumadin is like a blood thinner. I really don't know what Zetia is for. I'm gonna say D. Kalen and Isoptin are brand names for verapamil. Which of the following medications indicated for psoriasis is administered subcutaneously? for psoriasis. A. Let's look at it. Etanercept is administered subcutaneously for psoriasis. Betamethasone, calcipotriene, and triamcinolone are administered topically for psoriasis. That's understandable. Yeah, these are all corticosteroids. Triamcinolone, but I do remember seeing these as like either a cream or a lotion type. And the etanercept you would give subcutaneously or like a shot. Which dosage form is clear, sweetened, flavored, hydro alcoholic solution containing water and ethanol? It's clear. Is syrup clear? Suspension clear? It's between these two. I would say elixir. Elixirs are clear, sweetened, flavored hydroalcoholic solutions containing both water and ethanol. Colloidions are liquid dosage form for topical application with proxylin dissolved in alcohol and ether. Suspensions are dispersion in which small particles of a solid are distributed throughout a liquid. And then you got syrup is an aqueous solution thickened with sugar. What is the meaning of URI? Would it be upper respiratory infection, urethral and rectal infection? It wouldn't be that one because it wouldn't be both of these. Urine receptacle infection, receptacle really, or upper respiratory influenza. Have y'all heard that one? So for the most part, process of elimination, URI, upper respiratory infection. The last one here. Citalopram is indicated for the treatment of C. Good job. Citalopram is indicated for the treatment of depression. So let me go back here, show you again. Understanding your drugs, you have to know first what organ system it's working in. Then know your different drug classes within this organ system here. After that, then you want to put together whatever word stem it has. And not all of them are going to have a word stem on there. Like you got your antipsychotic agents, it's really not a word stem on here. But if you do find one that does, it makes it easier. And also know your indications as well. Found a website here. And this is the pharmaceutical benefit scheme. It's pbs.gov.au, and it gives you certain states the system of the body system. Then it gives you your different drug classes here. That is pbs.gov.au. Then /browse /body -system, and it should take you to that part right here. But it gives you, once you click on, let me see. Click on the body system. Then it gives you different drug classes. Let's look at beta blocking agents here. We'll click on this one as well. And again, you'll find out different medications that are for that certain drug class. And again, you'll see that the endings here, OLOL here, metoprolol, atenolol, bisoprolol, and that'll also help you as well. And you can also click on the drug, and it takes you to what the drug is. How it's taken, or if it's a tablet or whatnot. And if you're still in question of what it is for, you can always go to either drug.com, drugs.com. What was that? A little bit more? Okay. And it gives you, again, it gives you what the drug class, beta blocker, what it's for, heart circulation, blood flow. And I mean, if you go through these enough, and also find what the side effect is as well, that will also be helpful for you, because it will ask what are certain side effects of certain medications, whatnot. And mainly maybe the first 5. And a lot of these will have the same kind of side effects. Let me see if I can open one. Let's see. This one's hard to read. This one's kind of hard to read. But yeah, I would use that tool, drugs.com, and at least the first 5 of the side effects. And you'll find out that a lot of the drug classes have the same type of side effects as well. So if you put that together with your drug classes, you'll find that they have pretty much the same side effects, and some indications as well. Uh, let's see, what else is there? Got your calcium channel blockers. But any of the respiratory, or I mean, any of the organ systems here, it lists. Does it have, yeah, musculoskeletal? It gives you different drug classes here. Let's look at muscle relaxants. These different drug classes, and showed what agents are they, what they act on. They act on peripherally, centrally, or directly. Let's look at direct muscle relaxants. Let's look at something else. Let's look at peripheral. Centrally. It's not what I'm looking for. Let's look under anti-inflammatory and anti-rheumatic products. This states non-steroids. Well, you got diclofenac, which is usually a topical. It is either topical or PO actually. But if you want to find more information, go to drugs.com on that. Even what was the other one? RX list, rxlist.com. I'm trying to find the search. Here we go. Gives you your brand name here and generic formulation on here. So you got Arthrocheck, which is your brand name. Your generic name is diclofenac sodium, and you got your misoprostol, and they work the same. It gives you what its indication is for. Arthrotech is indicated for treatment of signs and symptoms of osteoarthritis or rheumatoid arthritis in patients. But it is very helpful as well, along with if you want to know a little bit more extra on it. It gives you your side effects, drug interactions is good to know. Just for, you might have some questions on drug interactions. Not so much as what the brand or generic is or what we just saw. We saw we didn't see that many contraindications of medications. So anybody got any questions? Like I said, it's not so much doing lab work, but if y'all want to do lab hands-on stuff, you can draw up stuff or whatever, but this is what y'all are going to be dealing with as far as the questions. Specifically, that's my main focus on having y'all understand the different questions it's giving. So, I mean, y'all want to do lab work, you can, but I can tell you won't get much out of it other than, it won't help you out on the exam. And they sent me some stuff, like IV stuff, but the exam is more geared to more retail than any of the hospital RRT exam, which is the certification for sterile preparation technician. That would be the next one down, other than your basic certification of becoming a technician. So it's up to y'all if y'all want to do hands-on work or more questions like this to help y'all really get ready for it. What do y'all want to do? Would you rather just have more questions?
I would. I think.
All right, just making sure, because they did send some work, some hands-on, like drawing up IV stuff, and we can do that towards the end, but it's not going to help you with the test. I can tell you that. Let me pass around the sign-in sheets. Just sign in right next to your name. You can take the test online as long as you have a computer that has at least doctor or somebody in the making sure that you sit there and not move and not look at your phone. And yeah, you can either do that or take it like at the Pearson, go to the Pearson testing centers. I think it's over there by the desk on 8th Street. Oh, you're not? Okay. But it's, yeah, then they might have to wait for this.
No, I just moved from Mexico. I'm never told
Oh, okay.
Yeah.
That we got to get here.
My brother's an RT at the hospital, so basically after all is meltdown in the COVID, I switched to start over basically.
Yeah, for the most part, you can take the test at home. So, yeah. Anything else? I believe it is time for an hour and a half to answer 90 questions. You got that. If I was to let y'all take that one test by yourselves, I'm pretty sure it would work out. I wouldn't do it that fast, but of course, I would answer all the questions I knew first, and then go back and then answer the questions that is a problem. So, they don't test you on the full 90. There's only a certain amount of questions that they will accept. I guess. It's not the full 90. It's a 90 question test, but they don't test you on the full 90. I don't know how to do it. Yeah, certain questions. So as long as you pass or get correct a certain amount of questions that they require, I'd say 75, at least 75%. Should be passing. For the most part, that's pretty much all I have. That's just mainly when you're looking at medications. Again, I can't stress enough, you have to know the organ system, the drug class, specific, that they have a certain ending on them, and just a few of the generic names for it, which will help you out a lot. You probably can get more training, say like for the certified sterile preparation technician. If you can get into a hospital pharmacy for that, that's usually what it's for, is for the hospital pharmacy. So if you get training in a mom and pop shop that does IV work or something like that, that'll help you out as far as hands-on training, and that would help you out in taking that test too. I'm thinking that you're probably going to have. We have not set up that yet. We are in the process of doing that. Right now, we're mainly focusing on that basic test. retail. But eventually, we're getting there. Like I said, I've only started this in 2000, kind of held back because of COVID, and we were going to start all that in August of last year, but because of COVID, kind of put things on hold. So now I'm developing a curriculum where, of course, you can do retail stuff, and I've got certain software coming in, hopefully by August, so that we can do like input prescriptions and stuff like that. So we can have we'll have computers in here, inputting prescriptions, certain putting in prescriber, putting in insurance information, stuff like that, so that people can become familiar with how retail works all in general. And then after that, we're trying to build a lab for the sterile compounding part of it, so that we can have more hands-on. And that's why we have this, but it's just like not enough room. And with that software, it will also allow us to implement lab work with sterile compounding as well. And on top of that, we'll be doing compounding as well, which is like making like trophies, sublingual tablets, stuff like that, so that you can familiar with how they do compounding, even like bioidentical hormones, making weighing out pills or powder to put in the pills or capsules and stuff like that. But that's still kind of down the line. Objective. That's more based on experience. Yeah, it's more based on experience. Yeah, and advanced tech is more like you could probably 5 years into that. More experienced, maybe experience in like IB work, compounding, retail, insurance, and stuff like that. But any other questions?
So, like, making the loads and then more in hospital things,
Which is
or you're saying about compounding, is that more in hospital?
compounding is more mom and pop shop type thing. Like what we have here, Medical Center Pharmacy here, they do compounding for bioidentical hormones, stuff like that. It's usually where you find compounding. We don't have any compounding facilities here, but in the bigger cities, Dallas, San Antonio, Austin, Houston got a big. I went down there to get trained. I was working for Medical Center Pharmacy, and they sent me over to get trained and get us certified in that as well. And I mean, it had a big, really nice facility. Everything was clean. Everything was white. I mean, it was really nice. I mean, I wouldn't mind working there. It was a really nice facility. But yeah, to tell you that there are different pathways to being a technician, just not this retail. But again, that's all I have for you guys right now. We'll go over federal requirements, and y'all don't mind, we'll do the same thing and do the question. And if you got any questions on the medications part, feel free to email me, or y'all come back up and get the kind of questions y'all have. But what else I need to learn. But again, you do get the book. Stuff we did not go over was like drug disease interactions, like some acids will cause kidney disease. And we talked about Tylenol, with the liver and stuff like that. The Tylenol with what else was it? Something to do with the heart or something. Maybe, yeah. Probably. But like, you know, stuff that we did not go over. The book has it. Um, you might can. I'm not for sure. I didn't tell you if they have it. I thought they did. I know Barnes and Noble had it because I had one girl who got it. Also, get familiar with the drug-drug interactions. Um, Interactions with over-the-counter drugs. Other than that, really become familiar with your organ systems and the different drug classes it has and the different generic medications. And again, your top 200 drugs, look over those religiously, knowing the brand name generics on those can tell you you need to know those for sure.
Based on the generic therapy, I mean the brand name therapy, the generic.
Generic, really. Really, it's more based on generic.
No, the different.
Yeah. Yeah. And mainly, it's probably just the first 100 that really got me stressed out. The other 100, it's good to know, but I mean, it takes repetition, and that's how I ended up passing the test because I was on doing things on site, and I was always trying to pull in meds. And
Yeah,
I was
it's
looking
hard
at,
to memorize right now because we're not really seeing it.
yeah, and that's the only hard part about it. If I had the software, I wouldn't mind like being and looking at different medications, pulling medications. But that takes a lot of time. Let's see. There's we only touched on certain body organ systems, so make sure you do look up like the musculoskeletal, your digestive, your respiratory, uh, of course, cardiovascular and your nervous system. So you have a lot of questions on those, and as well as your like immune system. They do have a lot of questions on the new drugs with HIV and AIDS and stuff like that. So make sure y'all do become familiar with that. I think that's about it. So, I don't have anything else. Please look. Y'all have a great evening. Oh, and we won't see each other till next Thursday. Right? No, because I have my son is so next Thursday, and then that's why those dates were changed to the 4th and the 6th. So that's it. Y'all have a good evening.